Okay, Shanice. So before I get started, I'm gonna read over the confidentiality
Sure.
agreement. So I am a student in counseling skills at North Carolina Central University. I'm required to practice counseling skills with volunteers. I appreciate your willingness to work with me on my class assignments. You may choose to talk about topics of real concern to you, or you may prefer to role play an issue that does not necessarily relate to you. Please let me know before we start whether you are talking about yourself or role playing. Here are some important dimensions of our work together: confidentiality, which is as a student, I cannot offer any legal form of confidentiality. However, anything you say to me in the practice session will remain confidential, except for certain exceptions that state law requires me to report. Even as a student, I must report an instance of serious harm to yourself, indications of child abuse or neglect, or other special situations required by the state of North Carolina. I'll be recording our session for my personal listening and learning. If you become uncomfortable at any time, we can turn off the recorder. The recording may be shared with my supervisor, Dr. Horn, and or the students in his class. You'll find that recording does not affect our practice session so long as you and I are comfortable. Without additional permission, recordings and any transcripts are destroyed at the end of the session. I'm an experienced counselor and I can't do formal counseling. This practice session helps me learn helping skills. I need feedback from you about my performance and what you might find helpful, and I may give you a form that will ask you to evaluate how helpful this session was. Did you understand all that?
I did.
Okay, and do you have any additional questions?
I do not.
All right, so let's get started. Are you doing a role play or a real life scenario?
This is a real world scenario.
Okay, what's going on?
So I just got a new job and I am a little bit nervous because I am not really sure what to expect from the job.
Okay, you have a new job and you're feeling nervous about it because you don't really know what the expectations are for the job yet. Where do you work or where you want to be working?
I will be working in Garner, North Carolina at Strategic Behavioral Health.
Okay, I've heard of that place. And that caters to children and adolescents?
It does, and they also have a Gero unit, which is geriatric.
Okay, that's pretty cool. And is this a type of work that you see yourself doing, or was this just something you kind of found because you needed a job?
It is something that I saw myself doing, and it is something that I kind of just needed to do at the moment because I needed to get out of the situation I was in.
Okay, would you like to dive into that previous situation or
I
stay
sure
more?
would. No,
Okay.
I can. So the previous issue was I was in a different population, which is a little bit different than what I'm used to.
Mm-hmm.
So just a little bit of background information. 2011, I actually started working with children, ranging from second grade all the way up to, I believe, middle school.
Okay.
I don't believe it was high school. Yeah, it might have been eighth grade, eighth or ninth grade,
Mm-hmm.
because I would have been in 11th grade. So I the first encounter I had was with people that were, or students that were at risk. That is the population that I love because when I get in that population, it's kind of just like, boom, you just got to do what you have to do.
Mm-hmm.
So after that, I did CTE for a little bit at my school, and then I
Okay.
went off to college, came back, the program was closed because of funding reasons, which was very, very hurtful for me because I know in the area that I'm from that that was something for children. And even though, and that was just something for people, give them something to do because I am from a very small rural town,
Okay.
and the things that goes on in that town from the time of 2011 even to when I go back now, it is just crazy.
Mm-hmm.
So I that really affected me because I just expected more and better. So when I moved here
Mm-hmm.
for school, I got into IDD, which is intellectual developmental disability. This is on the other side. This is mental health all the way. It's behavioral health,
Okay.
which is and corresponds with what I'm trying to do, which is mental health. So I'm going to be a mental health technician, but of course I'm going to try to window my way up to be a therapist there before I get my own private practice.
Okay. So It sounds like you have a history with youth, adolescents, and then you transition on to IDD, adolescence, and now you found yourself back here with at-risk youth, if I'm correct, and you want to use this opportunity in this job space to segue yourself up into being a fully licensed therapist.
Somewhat, I would not say that they are at risk. It's more of behavioral because it
Okay.
is more focused on trauma informed.
Okay, trauma informed.
Yes.
Okay. And trauma is something that really interests you.
It does interest me because when you deal with trauma, you're dealing with a lot of things and a lot of disorders. It can be PTSD, schizophrenia, major depressive disorder. Um, it can be a lot of things. It can be hallucinations, delusions, all things that I am interested in doing way different from at risk because um, I cannot say in 2011 that these kids have this type of behavior, this type of behavior. At this job, it is when they come into their intake process.
Mm-hmm.
This is where everything is already done, written up. They have been seen by a physician who has diagnosed, well, they already have a diagnosis of what it is. So it's definitely very different, but it's more on the spectrum of what I will be doing. So, I mean, I might as well dive in, but
Okay.
it's nerve wracking.
All right. And what's so nerve wracking about it?
Because I don't know what to do, but I'm also a person that, one, I talk a lot.
Mm-hmm.
I'm a person that it's not because of cockiness, but I feel like if I know something, I'm going to, of course, wait my turn. But some people find it as, oh, she thinks she's better than everyone else, or oh, she thinks because she has an education, she knows more than us. I didn't say that.
So it sounds like where you are very confident and assertive, people might believe that that is arrogance.
Yes, absolutely. And it's not. I mean, I am in my belief that it's okay to toot your own horn.
Mm-hmm.
It's okay to flaunt yourself. It's okay to compliment yourself. If you don't compliment yourself, who will?
True.
And I'm also not a person that waits on compliments because I don't need your compliment. It's nice, but I don't need it.
Okay. And that really shows that you have a real big amount of self esteem for yourself and self confidence in yourself. It's very powerful.
And I mean, yeah, that's what I portray on the outside, but inwardly, I am nervous. I think I'm more nervous about the staff because for some reason, everywhere I go, somebody has a problem with something I say or something I do. It's the air I breathe around that gets on their nerves.
Okay, so a lot of this nervousness is coming from your new future coworkers and how they are perceiving you.
Yes, it's a mix of both that and the children.
Okay, that and the children.
Yes.
Okay, so on a scale of 1 to 10, what would you rate your nervousness on each factor between the children and the staff as?
Okay, so for the children, I would rate it as right now at this moment, coming straight from orientation. Today I would rate it a 5.
Okay.
We also have orientation next week that deals with handle of care, which is a hands off procedure. It's a hands off procedure. So you want to do hands on as the last resort, but you try to do more de escalation, which I love. So because I've taken a lot of trainings, CPI, NCI, MANT training, I've taken a lot of trainings that have to do with holds and restraints, but do I really? This is a different situation because in those situations, these were adults I'm dealing with.
Mm-hmm.
We had a tour. I saw those children. What do I look like? Putting my hands on a 5-year-old to restrain them. You know, like, I'm not saying that I would do it to harm them or hurt them because you have to take, be conscious they are still 5. Mm-hmm. They have issues and diagnosis and trauma that's going on. So this is why you shouldn't want to do that. But that's for that. For adults, right now I'm okay when you're in training, everyone's hee hee ha ha hurrah, hey, how you doing? But
Yeah.
in all reality, that moment that you have to punch in and you're an employee,
Hmm.
you are now beneath them because they think they can boss you around. Um, we have managers that are over us before the administrative department,
Okay.
and they think they're gonna think they're better than us. And I mean, this is all from what I've heard from other people.
So a lot of this is what was told to you from people that currently work there or have worked there in the
They
past.
have worked there. I've heard from someone who has worked there for 3 years. I've heard from someone who has done PRN there, and I've also seen reviews. And if you were to go up there and to see a review, you might run. That's anybody, but I believe in forming my own opinion. But I just know from previous jobs, it is literally the way I walk, the way I talk. I don't even have to say anything. Like the air I breathe, they don't like it.
Okay.
So it would be maybe like this week, a 6, but next week it's gonna be at a full fledged 10.
So this week you rated it as a 6, but you feel that with the inclusion of the next training, it's going to elevate to a full blown 10. And that's in regards to your feelings on your coworkers or the children.
The coworkers it will be at a 10. The
Okay.
kids it might be at an 8 because they have already told us the kids are gonna try you. I know that though
Hmm.
because I know that from anywhere. That's what they do. And whether it's a behavioral issue, mental health issue, whether it has to do with intellectual issue, people on a daily basis will try you.
Sure.
So, but it's all on how you handle the situation. But I think it's worse for me because I know this is so much of what I want because I can elevate in this job. So I don't want to make the wrong move, but I'm not going to sit there and try to break my neck to please someone. I'm going to be myself. But I'm more so concerned about the staff, but I need to be more so concerned about what my job duty is, which is helping the children. So, yes, I am nervous, very.
Well, it seems like you do have a lot to be nervous about. But I like how you really pointed out that even though you are nervous, you're going to use this situation to elevate yourself rather than, just stagnate and leave the job. And I really like how when you've had all these reviews that kind of painted it in a negative picture, you want to form your own assumptions about it. I think that takes a lot of courage.
Mm-hmm.
So, in regards to this next training, how do you feel about your coworkers' perceptions? Like in the current trainings or the past trainings that you've been in, have you interacted with them?
Um, for this week, the training, we have had the managers from morning shift or night shift come in, and they seem all right. But whether you have a diagnosis or not, people change more than the seasons.
Okay.
So they could have an issue that's going on, even though they say do not bring your problems to work. People bring their problems to work. Even though it doesn't even have to be that. It could be something as simple as, you know what, I've been working long shifts because our managers work way longer than, a 8 hour shift or a 12-hour shift. They're there from like 2, if they're night shift, they're there from like 2 p.m. to the next day 7. Like that
Wow.
is insane, but that's what they have to do. So just being extremely overwhelmed, that can be a factor to them feeling a certain way or just acting a certain way towards new employees.
So you feel like their own personal problems or their own personal stress will impact them and have them project that onto new employees like you.
Yes, and I have spoke with the nighttime manager because that's the shift I will be working, and I told her I don't want to be put in a situation where you pair me up with someone. And this is a place that has to have cameras for a lot of different reasons because they need to ensure that the people that are, whether you're EOC, which is environmental care, or whether you're MHT, mental health technician,
Hmm.
whether you're a RN, registered nurse, or whatever you're doing there, whatever your duty is, they want to make sure that you're doing it and doing your responsibility. I get, but for some reason, people like to get paired with someone, especially on night shift, because a lot of people think on night shift you have nothing to do but clean and do your check, your 15-minute checks, 30-minute checks, hourly checks, whatever it is for the patient.
Hmm.
And they think that, okay, well, for instance, for example, oh, well, this is all you do right here. To me, that's not proper training, because then when I don't know what to do, that's going to fall on me because I'm new. So it's going to be easily placed on me. And I'm not a person that is big on confrontation, because I'm just not going to do that with you. And then I am going to become arrogant because it's going to make you mad, which I like to call nice nasty.
Okay. So what I'm hearing from you is you want to be paired with someone that has equal or same work ethic, and you want to be paired with a trainer that will allow you to learn the job how it's supposed to be done and not how to get by. And
Yes.
you don't want to go to night shift and have this persona of not being a hard worker, because you are a very resilient and hard worker, and you're gonna tell them that and inform them that, so they will treat you as such and you will elevate yourself to where you want to be.
Yes, and I came from a job that I did actually like, and it was just unfortunate that there were some miscommunications, and I thought that I was going to come back and my job would be secured, but it wasn't. But thankfully, I had many tricks up my sleeve, so of course I had another job.
Hmm.
So I was probably out of work for like a week, maybe two
Okay.
weeks. I don't know. It wasn't long because I'm always going to get something else because I'm going to be diligent in my searching. But I worked on a shift that I did not know anything about. And while I was over there trying to figure out what to do, there were
Hmm.
people on the other side who were just like looking like, she doesn't know what she's doing. Well, of course not. But I'm trying the best I can because this is not the shift I work on. I work on first shift. We don't have to put, you know, people in bed or make sure there's showers and stuff. We don't have to do that. I don't know anything about doing that because I've never done that before. And they did not help me. It was more of a, look at that girl over there. She don't even know what she's doing. Like, why did she get hired and she don't know what she's doing?
Okay.
Really?
So with the last job, the one before the current one that you have, you were thrown into a situation in which you weren't trained. And since you didn't have any training, you didn't know what to do. But it seemed as though the employees felt as though you shouldn't have been there. Like they felt like, since you can do the thing on your shift, you should be able to do them on all shifts. And to me, that would make me very frustrated and angry. Were you feeling frustrated and angry in that moment?
I was very frustrated and I was sweating, which I don't normally do. So that's how I know I was working so hard because I was sweating. And then it was like the last minute, it was only one person. Like she was so nice to me. She was like, "Do you need help?" And I was like, "I think I got it." Like I'm good with asking questions, but sometimes like I feel like if you didn't want to help me at the beginning, don't try to help me now. But I understand she was doing something else. She was doing meds, so she could not really do anything else, and they were already short staffed. But you give me the hardest people to deal with, and you know that they're hard to deal with because you deal with them on a normal basis. Like
Mm-hmm.
you already know they're hard to work with, and you get the easier side that can really do it by themselves. All they got to do is go in there, do their business, and walk out. And you only have really one person, and I'm sitting over here with four people that can't do anything by themselves.
So you would have to take on the care of the four people that can't do anything.
Yeah, and you're sitting, and I'm over here sweating, like my edges are curling up. Like, come on now, this is like extremely hard. You didn't even at the last minute, and I'm over here trying to be nice to you and say, "Oh, do you want me to get that?" And I'm over here working hard, and you're chilling because this is what you're normally used to doing, which is fine. But I feel like it's common courtesy. Like it's not you do this and you do that. It's a team effort. It's a team approach. You can't just do everything by yourself. If that was the case, then you run the whole thing by yourself.
So it sounds like teamwork is a very important work value for you.
It is.
And in that last job, you in that instance, on the second shift, you didn't have teamwork at all. You were just thrown in with the wolves, and you reacted as such.
And that, yes, but I've worked on second before in a different place, and it
Okay.
was not like that at all.
So, from my understanding, there were two different houses. You worked primarily first shift on the other house, and then they put you a second on a different house.
Yes, I mean, I've worked in that house that they put me on for a second. I've worked there before too, but in the morning, like
In the
I
morning.
never, and I do know how they are, but I hadn't been there that long. I've only been there for a couple of months, and it was just hard. And I wanted to go tell the scheduler or the manager,
Hmm.
but I just know, I know people, and I know my people, and the way that we can react to things or the way that we can um, discredit or feel like we can't help somebody because you don't have to, that is like a slap in the face to me. So going into a new job such as this one, it's like I don't want to have to deal with the same thing. And I'm a person, if you look at my resume,
Hmm.
you'll be like, gosh, this girl spent summer everywhere. I'm young, I'm 23.
Okay.
I can go where I want to go. And if I feel like a job is not benefiting, it's not that it should benefit me so much. It should be that I can be a benefit and I can be an asset to them and the company. However, I'm also a person that feels like when my job and my duty is done, then I will be led somewhere else where my service is needed.
Okay. How will you know when your job and your duty are done?
When I have mastered it, did I master doing that? Um, I learned, but as I said, that was an unfortunate situation because I went somewhere and I came back and communication was not how it should have been.
Okay.
So it was kind of an unfortunate leave. And when I tried to come back, it was just too much. It was too much going on. So I went to another job and the same thing happened there. It was only one person
Hmm.
that said, "Hey, girl, do you want to do this or that?" And we've been friends ever since. But I'm a person, I like to observe. I like to see what is going on, how it's going on, why it's going on. I try to say to myself, but I don't want to get in a training and you're just like, "Oh, well, girl, this is how it goes." And yeah, this is how I do it. What does the policy say?
I
I'm a
see.
strictly by the book person.
And you follow the rules.
I do follow the rules, not because there's cameras there, not because I want people telling me so much what to do, or because I'm scared of another individual that's been there longer than me. No, because I know I have an ultimate goal. My ultimate goal is to be a mental health counselor,
Hmm.
which means I'm gonna get the experience that I need, but I'm gonna get it the correct way. I don't want to go in a place and try to counsel someone I don't even know what I'm doing. Absolutely not.
Okay. So, in regards to this new job now, and you saying that you want to move up the ladder, in what way do you feel that this will prepare you to be in that counselor role? What are you looking for this new job?
For this new job, I'm looking to learn how to notice different behaviors. When we were in
Hmm.
our training today, the trainer said that schizophrenia was her favorite. Now, I don't know too many people that say dealing with schizophrenia is their favorite. However, when I first decided to do psychology, I was like, you know what? I want to work with people with schizophrenia, multiple personalities, paranoia, hallucinations, delusions, because that to me was so intriguing. But then I thought about it. I am a person that I overthink a lot of things. I don't want to take that home with me, and I don't want it to lead to burnout. So I say, you know what? Maybe that is not specifically what I need to be doing because I will think that, that person is in my room.
I see.
However, I think from this job that it can ensure that I know more about different disorders, how to recognize signs and symptoms, know am I in the as they will call the front of the house, which is like your administrative staff, your HR staff, your business management side. No, I'm in the back of the house, but I will be working my way up to the front because um, the experience that I have learned from psychology in undergrad, and of course, the experience that I'm learning along the way from my professors while I'm getting my master's degree. So I'm very thankful for that because this was the section I was waiting for, which was the clinical portion, the mental health portion. I was surprised by the number of people that were in there and had no idea what a DSM-5 is, but you're working in a behavioral center.
Oh, wow.
I was like, what? And when she asked, because this was like a video recording, so it was all the 11 locations they have. And she told you would click the mute or unmute button for whichever location, and she called on the location here. Mm-hmm. And she was like, can someone tell me what the DSM-5 was? Of course, I raised my hand. Can someone tell me the difference between a hallucination and a delusion? Of course, I raised my hand. Can somebody tell me? I mean, it was just thing after thing, and I was like, let me not raise my hand anymore because I know they're like this girl. And there was another lady, but she's already a therapist. Yes. So you have reign over everyone because if you don't know what that is, then I'm going to start questioning where'd you get your license from? But who am I? But still, it was, but that's where you can tell. That's where that maybe cockiness will come in.
And that's why
but I'm not.
Think that you're arrogant.
But I'm not.
You just are knowledgeable. And it's just, you're very proud of being knowledgeable. You really light up when you talk about these topics.
Whew, I get so excited because I just know that I'm so close. And like, to be close, it's not good enough, but patience is a true virtue because you don't want to get into something and you think you're ready. And then I don't know what everyone else believes, but God tells you or shows you that you were not ready. So don't try to throw yourself into something and you think you know everything because I don't know everything. I'll be the first to say I don't know everything. It's so much that I have to learn.
And it's good to be humble like that.
I try, but I'm just very scared because I know how my mouth is. And it's not one of those, oh, girl, blah, 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 or boy, blah, blah, blah. No, absolutely not. It's more of a, what I'm going to give you is going to shut you up because the education that's going to come with it is going to be dangerous. And you're not going to know what to say.
Okay. Is there any way that you can give the information in a way that would not influence a negative impression of yourself?
No. And I feel this way because I am a strong person, period. I've always been that way. And I was always taught by my sweet, sweet grandmother, who gets on my nerves at times. I was taught that when you speak, you need the whole room's attention. So when you speak with your head up. You let them, you speak very loud and, well, not loud, but you speak very clear so that people can understand what you're saying is serious. So I've always demanded that attention because that's what I was taught. Like, if you're going to say something, say it in confidence. Because the people that get ahead are not the ones that are quiet. It's the ones that open their mouth and say something. You could be the smartest person in the room. How does anyone know? You haven't said a word.
True.
So that's just where I am, and I'm ready, like, I'm very ready, but I'm so scared, like, because I'm not afraid of a child doing anything to me, because they are they see us as superior to them. I am not superior to you. We are the same. I'm here to help you, to guide you, to figure out what goals that we can reach so that you can leave the program and learn how to be more independent as a child. You can't be so much independent because you're still a child. Mm-hmm. However, to see people in their 5 years old diagnosed 6 years old, really? How? I mean, I know how, but it's just like something has to be done. Like, I really thought, you know what? Just adolescents and adults work for me. No. Children have to be in there somewhere. Like, something, but it's more so of how do I get there without me trying to be too overly confident, and I guess as people would think arrogant, but without me being too far in the background where I'm not helping them because I'm afraid that these other staff in here are going to make me feel a different type of way. That's where I'm stuck.
It sounds like you're trying to find the mean in between two extremes.
Yes.
Okay, so in the past, in these situations, since it seems as though it's been a common occurrence, in what type of situation do you feel like draws the most negative impressions towards yourself? For example, when they ask the question about the DSM and you raise your hand, do you feel like those are the type of situations in which you're seeing that more people are forming negative impressions towards yourself, or is it just in small talk situations?
I think it's both because there's a guy there, he was there before. And I think there's a clear difference between him and I. There's a difference when you've been there before, but everybody knows things change.
Mm-hmm.
I am receptive of your information. I can take in your information. I'm accepting of it. However, I'm not accepting of a person that talks over the leader. I'm not accepting of a person who says, boy, every time something gets said, you have to make a slick remark because then I can't hear. And if I can't hear, then I'm not going to say anything, but my face is going to say it because I can't hear and I'm sitting in the front. But I think for me, it's not even what I say. It may be how I say it.
How do you feel that you say it?
I say it with confidence, but my definition of confidence is someone else's definition of cocky. That's not true. Like, they asked us about ourselves, and I said, well, why do I want to do this? Because I have a mission, I have a purpose, it's personal for me, and whatever else I said. And I said, I mean, right now I'm in grad school getting a master's degree in mental health counseling and a certification in substance. They also have a substance program, not specifically there at other locations. That just like y'all told the wrong person because like, woo, y'all don't know what y'all just did. However, it's just like I saw everyone's face. It was just like, why are you here? I'm not taking from you. Everyone's paycheck, you're still gonna get your paycheck. I'm not taking anything from you. I think that's more of their issue, but it's more so of me thinking what they're thinking. They couldn't be. What if they're not thinking that? And it's just my thought that everyone is just against me. Maybe.
You could say that. I mean, if you feel as though everyone has a negative impression of you, but it could be the opposite. Have you ever talked to anyone one to one about how you are?
I did actually. There was one lady there, and the first day I said I never had a chicken taco. I know this is like so off. I told her, I said I never had a chicken taco, and she was like looking down. It's not a taco, it's a quesadilla. Well, excuse me, I never had a chicken quesadilla either. Or in my mind, I was like, well, if I had recognized it, I would have said quesadilla, but I didn't know that. So in my mind, the next day I was like, I'm not even gonna say two words to this lady because I could already tell she had an attitude. You don't want to be bothered, or maybe she didn't have an attitude. Maybe it was something going on with her, or maybe she was just in her food and she was eating and she was in the process of it. So the way she said it was just not, or that just may be the way she talks because she's not from here, so she has a thicker, stronger accent because she's from up north, which I can kind of relate to because I'm from up north.
Okay.
But the part she's from is very different. I know their accent is strong. But first off bat, I was like, I'm not going to talk to this lady because apparently you have an attitude and I don't need this. I don't need your attitude because we're in here doing the same thing or trying to accomplish the same thing or same goal, I'm thinking. But I went there the next day and she was like, it's something about you. You may not realize it, but for you to be your age, I can tell this is what you want to do or a step to what you want to do.
So it sounds like she showed the opposite the next day of what you were perceiving of her attitude towards you. Instead of it being something like aversion. It was more of, I'm proud of you. And she seemed like she was genuinely, interested in your passion towards fulfilling your goals to be a counselor.
Yeah, she was, and she was actually really nice. She said that I would be a person that she would hang out with because I'm very motivational for her to want to do better, and for her to be older and I'm younger than her, and she can find motivation in me. That's like really something because she doesn't just do that. And she was saying things like, um, sometimes it's okay to toot your own horn. You shouldn't have to feel like. Um, you can't do that. It's not it's not wrong to do that. It's not wrong to be confident in what you're saying or what you believe in.
Mhm.
And we actually watched, all of us in there, we watched a TED Talk, and it was the people that succeed versus those that don't. And it's three different things. The biggest circle is a what, the second circle is a how, and the smallest circle is a why. And the example he gave was Apple. Um, why is Apple different from any other computer software? It's the same thing, but it's because they started with the why. If
Mhm.
you believe in something, people people will support your belief more than just what it is. So like she could see the why behind why I want to do this, and that's what made it more so of, being more real. So I don't know.
Well, it's good that she was able to see the why behind your impressions during the meeting, and potentially maybe some other people might see that why as well. And maybe it's not jealousy, but them feeling more inferiority towards you, which they shouldn't feel.
Right.
So, in regards to this job or any job, let's say when you are a therapist, what are you looking for in that? Because this seems like it's going to give you a lot of experience to put you where you need to go.
I think so.
What are the types of experience that you hope to find here?
The experience that I hope to find here is one that can lead me to my ultimate goal. Because, like I mentioned earlier, I thought that I would only be able to work with adolescents
Mm-hmm.
because I felt like I was too hard. I was too hardcore for a child. But I'm here working with children. Like my past experience, even though the first one in 2011 was at risk, that was the CTE, and when I was a RA, but RA is a little different. That's just interactions with people. That was, well, let's exclude that. Those other two times were the only times I worked with children or
Okay.
adolescents. Everything else was strictly adults, 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 adults. And I tried one time even working with someone who had IDD and he was a child. Have mercy, Father. When I say that he gave me the hardest time, he ran away.
Mm-hmm.
And I can't run from here to that door. And the fact that he ran and I had to run, I learned I ran that day. So it's more of me not limiting myself. So this job can give me the opportunity to go further, not to limit myself, not to think just because I know I'm not going to be perfect at everything as a counselor. Every technique isn't going to work for
Mm-hmm.
me or for every person. Every person I deal with is not going to be an African American or a Caucasian. They're going to be different from different cultures. So I'm being put in a situation where I get to experience different cultures. I get to use what skills that I have learned from every course I have taken, which I try to do anyway. And sometimes it works, and sometimes I think because I try a little too hard, people like I don't get what's going on. But um, I think this will give me the rise that I need to go to the next step, which will then give me the step to really being a counselor.
Okay. So it sounds like this will give you the ability to you will have basic experiential learning by working with this population that you never worked with. You not that you never worked with before, but you've had less experiences with that you didn't see yourself with. You're going past your comfort zone and you're exploring this option that you never thought, and it's giving you a lot of feelings of confidence and empowerment, while also having you think of the other potentials that you can do as a counselor. And it sounds exciting. Like, it makes me excited when I'm thinking about it, just getting into the
I'm
field.
very excited. Excited. Can't even talk. I'm very excited. Like, this is all I ever wanted. Well, actually, I thought I wanted to be a psychologist, but once I found out that that's not what I wanted to do, like, this was like, this is it. Like, this is it. I don't know what to say. Like, me having that feeling makes me not worry about those staff.
Okay.
It makes me not worry about what they have to say. It doesn't make them less of a person and me greater than them, but it lets me know that the calling for what I'm supposed to do is greater than their negativity or what I think would be negative. So right now, talking about it takes my level 6 or even my level 10 for next week way down to a level 2 because we're all here for a specific purpose and a job. That brings my level, I think next week it would be a level 7 for the kids, and this week a level 5. That would bring that way down. Well, maybe not way down, but maybe to like a 2 or a 3.
So finding your region in life fulfillment and finding reasons to be empowered reduce anxiety for you.
It does.
And it sounds like by you speaking to me on your past experiences with other jobs, as well as your own fears towards coworkers and how they perceive you, as well as working with a population that you haven't worked with before, really kind of seem to just level you out. It's like you vented, and now that you got it all out, the only thing you're left with is excitement, and that's
Yes,
good
I'm
because some
so
people need that.
excited. Yeah, you're right. Like, but I just hope I don't get tired. But you can't get tired of something that you love or want to do
Okay,
because every day is not going to be easy. And I don't expect it to because then it's not worth doing
okay.
in my eyes.
So eventually in the future, where do you see yourself working with kids, adolescents, or adults based off of, your multiple experiences?
In the future, I see myself. I see myself really going further,
Okay.
going back to first of all, going back to my community. I can't save everybody. I'm not looking to save you, but I'm looking to let you see life differently because that is the only life they knew and know. So, that with all the issues they're dealing with, it's like there's no hope for them. I'm that hope.
You're the advocate.
I'm that hope. More than advocate. I am that hope.
You
I'm
are
that
the hope.
picture. I lived there too. I was there too. Growing up the same as them. Now, was it exactly the same? No, but I was there. I was there to even hear you all out. So, the same way that I did it then, I'm going to do it now, but I'll have more experience and I'll have more knowledge to give you to not really get you out, but to see things how you want to see them to be better for yourself. So, that that's how I see myself going back there,
Hmm.
helping them, but not just going backwards, but going further. Practice there, practice here, practice over there. Dr. Monet, that's my middle name. You can't call me Shanice anymore. I'm just kidding. You can call me that too. But doctor, because not only do I want to do that in a practice, why can't I teach somebody else? That's why, because I don't want doing research. I want to be I think there's a difference between a professor and a teacher. Like, you can profess anything. I love my professors, but it really takes a person to teach.
It does.
And for people, students that want to be like them to reach them. You can tell genuine from someone that's not. You can tell authentic from people that are not. And that's why, like, the professors I love, I love for a reason because they are teachers and they make me want to do that to teach someone else. They won't have the exact same passion, but they'll have something that's meaningful to them. And that's how I feel like I can go further.
Okay, so you are going to be the hope that inspires the masses in your own community and wherever else that you go, and you're going to lead by example and lead by being a model. And it sounds like by you reaching this, that any anxieties that you encounter along the way would be reduced because you have an eventual goal to get to. You have people that you want to change, as well as you want to surpass your own limits and transcend into a better person or the best person you can be and become the lighthouse of hope to others, which is a really amazing goal and skill.
Thank
so I look
you.
forward to one day calling you Dr. Monet.
Thanks.
Okay, so before we wrap up, is there anything else that you want to hit on? I'm gonna do a real quick summarization, but I just want to ask you that question.
I don't think so. I think that, you know how people say they came to the light? I think I came to the light. I came in here like, but now I'm coming in here like, it's just going further. So I don't think I have any questions or concerns.
Okay, so initially when you came in here, we were talking about anxieties over working with a population that you haven't worked with, as well as interpersonal impressions about yourself from other beings. And eventually, through that, we went through your past jobs as well as a job in which you didn't like because you were put into a situation in which you had a lack of competence and that led you out of that job. Mm-hmm. However, due to your ability to be resilient and confident and detail and plan oriented, you had another job wind up within a week and you moved on to this current job in which you were excited to work with a population that you haven't worked with, as well as it has these things that you are learning in your program that will allow you to learn in a more experiential way. And eventually, by learning through this and working with this population, you'll be able to build yourself up into the counselor that you eventually want to be, where you go and you bring hope, joy, intelligence, confidence to others, as well as personify them in yourself. One day you'll be Dr. Monet, and you will be a teacher, not a professor, because anyone can profess anything, but it takes a real, true heart and a real, true gift to be a teacher. You not agree?
Yes, that is perfect.
Okay, well then we'll end here.
Thank you.